Hi, I'm Dr. Mona Morstein, and let's discuss the best ways to go over the IgG food sensitivity testing with your patients. I always have, of course, the patient looking at it. I'll start off saying that when we look at this food sensitivity test, all the blacks are negatives, and those are all foods that you can eat. I think it's good for us always to be focusing with patients on all the foods they can eat and not just focusing on the ones they can't. There are some positives here. They're in red. Now, one thing about interpreting the test results that are positive is that you'll see at the very bottom, ALA-test lists out the ranges of a negative, a 1, a 2, or a 3. And you'll see there one starts at 0.200, but the line underneath says, in reality, they're not quite sure it's a positive until it really attains a 0.215. For me, that means I'm going to remove the positives that don't obtain a 0.215. On this test results, then I would knock out oats, corn, cabbage, grape, kiwi. There are a few foods that I'm going to cross out because if they haven't attained that 0.215, I'm not sure it's a food sensitivity and I'm going to let it go. You may choose otherwise. You may choose that from 0.200 it's a positive, and that is a very good way to go as well. But from then on, all of the foods need to be pulled out. There are some physicians that mistakenly think I can let all of the ones go and I'll just pull out the 2s and 3s. That's not correct. What we know is that the lab may say this is a 1, 2, and 3, but in reality, patients may be very reactive to a 1, and there may be 3s that they're going to be able to add in that aren't any longer causing them clinical symptoms or signs. So the way the lab interprets it is not always how a patient is reacting to the food. How long do patients have to avoid these? In reality, just 1, 2, maybe 3 months. We pull them out until the patient has a significant improvement in the condition that we were doing the food sensitivity testing for. And this tends to happen sooner than later. We also have to realize is that they're not sensitive to all of these foods. Certainly over 5, over 10, and absolutely over 15 positive foods truly indicate a situation of intestinal permeability, which is leaky gut. This patient is very sensitive to dairy. Came back cow's milk, came back goat and sheep milk. When we look at this, you'll see that almost all the test is positive, but for whey and blue cheese. Don't allow your patients to have whey and blue cheese. This is a positive test for dairy, and the test has to be interpreted by you, and that information has to be given to the patient. For me, if they come back positive cow's milk, and even if the others were not positive, we have to avoid all dairy. So again, this is a test, and we have to have physicians with experience interpreting this best for the patient in the least confusing way. The least confusing way is if there's positive in this, say, dairy category, it all has to be removed. Now, in likelihood, this is the patient's #1 food sensitivity, and they probably have been eating dairy. Most Americans do, didn't know that he was sensitive to it, and it caused damage to the gut over time, and it developed into that leaky gut, those loose, tight junctions. And so all of these other foods, such as blueberries and cherries and poppy seeds, mushrooms, they're just coming in through the leaky gut. But when we pull all the foods out, We'll give some supplements to help heal that gut. Within a month or two, when the patient is better, they don't have their sinus, their asthma, their GERD, the situation that the dairy is causing has been significantly, if not entirely, alleviated, then we start adding the foods back in. Start with all the foods that you're almost sure the patient isn't really sensitive to. Because psychologically, when the patient's been avoiding a food for a month or two, it's really, I think, important for them to get and see that they can add a lot of foods back in without a reaction. So they have this positive experience that they did this, they avoided all of those foods, and now they can add back in this and this and this and this and this and this and this, and they can add back in all these foods, and at the very last foods, add in the ones that you think are really going to be problematic. And of course, that is your dairy, your gluten, your corn, your soy, almonds, coconut, the ones that seem to be the most problematic for most patients. So that's how we look at and are addressing a typical food sensitivity interpretation with patients.